Welcome to City Club of Portland's Friday Forum. I'm Courtney Nelson, president of City Club. For 100 years, City Club of Portland is where civic-minded people come together to make Portland and Oregon a better place for everyone to live, work, and explore. We're gathered at the Sentinel Hotel, along with all of you listening on OPB Radio or viewing on Portland Community Media or YouTube. The generous support of City Club's corporate and media partners enables us to put on the state's best civic programs week after week. Our media partner is Oregon Business Magazine, and our current Friday Forum sponsors are Avangrid Renewables, Airbnb, McKinley Irvin, AARP, and Uber. Please join me in thanking our sponsors. And now on to our program today. As President-elect Donald Trump reveals plans for proposed changes to the Affordable Care Act, there are real implications for Oregon's healthcare system, which has been undergoing a transformation since the implementation of Obamacare. Today, we're here with local healthcare leaders to hear them share their insights and potential impacts on Oregon residents. Let me introduce our speakers today. Unfortunately, Nkenge Harmon Johnson, who is president and CEO of the Urban League of Portland, is unable to join us. Previously, she served as communications director under former Oregon Governor John Kitzhaber. She's a native Oregonian and was raised in Northeast Portland and Salem. But she's going to be watching the live stream and will be tweeting from the safety of her home, so we can follow along with Nkenge on Twitter. Up here on stage with us today, we have Janet Meyer, who's the Chief Executive Officer of Health Share of Oregon, the state's largest coordinated care organization serving more than 210,000 Oregon Health Plan members. Previously, she served as Chief Operating Officer for Tuality Health Alliance in Hillsborough, and she's worked in the managed care industry for over 20 years. Mel Rader is the Director of Upstream Public Health, a nonprofit dedicated to improving the health of all Oregonians. He serves on the steering committee for the Oregon Health Equity Alliance and is on the board of directors for Health Share of Oregon. Moderating today's conversation is Laura Gunderson, editorial and commentary pages editor for the Oregonian and Oregon Live. Please welcome our panel today.
Thank you so much, Courtney, and thank you too, and thank all of you for joining us. As Courtney mentioned, the Affordable Care Act, also known as Obamacare, was signed into law in 2010 with the aim of providing affordable health care insurance for all Americans. People who previously couldn't afford health coverage or were denied it due to a pre-existing condition suddenly had access to insurance. At the same time, some Americans faced hardships under Obamacare, such as increased premiums and the threat of fines if they didn't sign up. Repealing the Affordable Care Act was the centerpiece of the Trump campaign. Janet, what aspects of Obamacare are you most concerned about Oregonians losing?
Wow, that's a big starting question.
Let's jump right in.
Well, I think obviously in Oregon we've been very committed to the expansion population under the Affordable Care Act, which brought health insurance to adults, low-income adults, making around $16,000 a year. So Oregon was very successful in the expansion during 2014, beat all projections, blew all the projections out of the water. We've been caring for this population for a few years now. They've benefited from insurance, and of course we don't want to lose that opportunity to keep them insured. You know, there's a lot of other aspects to the Affordable Care Act that could probably use some improvement. I think we'd all admit the individual market has struggled a bit, both in Oregon and nationally. But I think that the expansion population and covering Medicaid for low-income adults is fundamental to the values of Oregon, and I think really fundamental to the values of the country as well.
Mel, would you like to add to that?
Sure. I mean, I absolutely agree. The expansion of Medicaid is one of the most critical pieces of the Obamacare plan. It's a moral priority in my mind to provide health care for those who cannot afford it in this country. And that is a critical piece that I am worried about. And Paul Ryan had indicated that he's looking at a plan to move a lot of those decisions back to the states and phase out federal subsidies around that expansion population, which is concerning around what that means for people down the road who may not be able to afford health insurance. I think another piece around the Affordable Care Act is it's been such a balancing act around to keep costs down, to expand coverage, to focus on prevention and other pieces. And because it's such a complex balancing act, it's hard to take out the unpopular pieces and keep the popular pieces. And it's driven a lot by the economics around healthcare. And so where the unpopular piece around the individual mandate is a critical piece in that if you just take that piece out, you will see healthcare costs go up significantly because they are those that will pull out of the insurance market are those that tend to be healthier, that have fewer healthcare costs, and when those get pulled out, then those with that bear much higher healthcare costs, like those with pre-existing conditions, those with older populations, increase the healthcare pool. So I think that's another critical piece, and I think because the individual mandate is the unpopular piece, that will probably be one of the first things that they're going to try to pull out, and how we make the rest of the pieces work so that we have affordable health care is a big question and a big concern.
Follow up a little
please.
bit. One of the things we're concerned about is when the average citizen hears that Affordable Care Act is going to be repealed, then we get calls from clients that say, is my child going to lose their insurance? And there's confusion amongst the people who are enrolled in Medicaid or who have individual market plans, what this really means. And I think we all need to be really careful, including the incoming administration, about what are you talking about when you say repeal the Affordable Care Act? Like Mel said, you can't pick and choose what you like and what you don't like because it is a balancing act. But even if the Affordable Care Act was repealed and the adult Medicaid coverage went away, we still cover a lot of people in the Oregon Health Plan and in Medicaid nationally, and that would not be affected. So it's really important that we continue messaging that to pregnant women, disabled, low-income children that are categorically eligible separate from the Affordable Care Act.
But to that, I think we hear a lot about, and I think you already mentioned Paul Ryan and what we've heard there in terms of block grants. So it feels, I think I hear people talking about being scared on multiple fronts. How would the block grant program affect Medicaid? What would happen there, and would that change then for Oregonians?
Sure. I think in terms of trying to identify what's going to happen down the road, I think there's a lot of speculation here. And I think, Trump's saying one thing, Paul Ryan's saying a different thing, and I think Paul Ryan doesn't necessarily have the full support of his caucus, and the Senate vote is looking even more difficult in terms of trying to find a majority for repeal. So I think there's a lot of ifs here, and we aren't sure. But in terms of the question around block grants, the concept is really to shift focus for the Medicaid program to the states, and providing a significant block grant to the state and giving the flexibility of the states to design the Medicaid programs in a way, in different ways. And I think what we'd see with that approach is some states would do it really well, others would not do it so well. I think we'd also see states that have a more income, a bigger tax base, are going to provide better health care than those that have a lower tax base. So, and I would also say, as part of that, part of the proposal, the block grants that are being proposed are not the same level of support that currently exists in the Affordable Care Act. So not only is it a shift back to the states, it's a decrease in the federal commitment to health care. And so the states will either need to pick up the slack or cut coverage. And I think, and there's ways to be more efficient. I think there's certainly ways to be more efficient. We can certainly find efficiencies about in a variety of different ways. But the efficiencies are not going to be big enough to really address some of that decrease in terms of the block grants. As many of you know, Oregon's facing a huge budget deficit of $1.7 billion in the state budget. And so, you know, with the current decrease in federal funding, along with you know, potential bigger decrease down the road related to the proposals around block grants, that puts Oregon in a very difficult position where we either need to hunker down and increase our taxes, or we aren't going to be able to sustain our commitment to the Medicaid population as we know it. And I think that will be the challenge moving ahead from Oregon's point of view.
I think the other thing I would add about this block grant funding concept is that Medicaid has three major components to it, and most of us only think of the Oregon Health Plan component or the Medicaid insurance for low-income individuals. But Medicaid funding also supports the safety net, and it's essential to supporting the safety net and sustaining it. And the third big area of expenditure for Medicaid is long-term care. And I think when the states and the feds start sitting down and really sussing out what it means to go to a block grant, you know, it's more than just throwing cousin Cheryl off the OHP. Now you're talking about maybe kicking grandma out of the foster home she lives in, because long-term care funding will be affected by this block grant proposal. And so I think there's a broader coalition that can be brought to force around Medicaid funding the more we get the word out about what Medicaid funding really does in our country and what the impact of a block grant would be.
Well, and the other concern we have for grandma, I think, on that same front is the what we're hearing about the voucher program. Some people think highly of it, some don't. Could we talk about what that would look like and what that would mean if the Medicare opportunities came through voucher to Oregonians versus what we have now?
Sure. I mean, the basic concept is provide a voucher and to Medicare population, and they can buy into different insurance plans. I think you know, I think where people get excited about this is the idea around more options, you know, in terms of which what kind of plan you want, in terms of who you can see, and so on. But to me, the big concern is this appears to be a hidden way to essentially cut costs from the federal point of view, which means down the road that seniors who cannot fully afford the voucher piece, I mean the piece that the voucher doesn't cover, means you know, we'll see less care, people causing problems. The funny thing about the healthcare system is you pay for it one way or another. Either you pay for it up front with providing good insurance plans, or you pay for it in the emergency rooms, or you pay for it in long-term facilities. And so I think trying to find savings among people who can't fully pay for the coverage means that it ultimately will cost more down the road. And I think there's been a number of studies around looking at so-called cost sharing, you know, asking individuals on Medicaid or Medicare to pay for different pieces, co-pays, and so on. And for the most part, it provides incentives that aren't useful. It means individuals are not getting the continuous primary care, the preventive services they need, and they end up spending more money down the road. And so that's my big concern around the Medicare privatization, Medicare voucher program. I think this will be an incredibly volatile issue. I think it's potentially incredibly unpopular, depending on how this plays out. And so for that reason, I think we don't know how this will play out. And in fact, Trump did mention he did not want to touch Medicare, unlike what Paul Ryan and said. However, Trump did has appointed somebody to head the DHHS, the Department of Health and Human Services, that is very committed to privatizing Medicare. So, so we'll see how this one plays out.
For those of you listening on OPB, this is City Club of Portland's Friday Forum. I'm Laura Gunderson, Editorial Pages editor at the Oregonian. I'm here with Janet Meyer, CEO of HealthShare Oregon, and Mel Rader, Director of Upstream Public Health. Today, we're discussing potential impacts to Oregon's healthcare transformation as President-elect Trump reveals his plans for changes to the Affordable Care Act. I'm curious if we could take a little bit of time to hear from the experts about what, if we had President-elect Trump here and perhaps Paul Ryan, what suggestions would you have as they move forward with this to best make changes that would help the nation, help Oregonians?
I think we have to agree on whether access to health care is a basic right of being a citizen of this country or it isn't. Is it something that's earned or is it something that's assumed to be part of the package that we give our citizens? So I think that would be the first question I would ask. Where on the spectrum does access to health care fall? I think it's really challenging for most of us to really understand what it's like to be low income in this country and to have concerns about housing, about food, about safety, about educating your kids, about all the things that our low income residents have to be concerned with, and then to have barriers put to some very basic things like health care seems a bit egregious. So I think I'd like to understand more about where they see it fitting, particularly when you're talking about vulnerable populations.
Is there anything you'd like to add to that, Mel?
I think that was fantastic. I would say, let's expand coverage, not cut coverage back. Let's look for more efficiencies. I think there's certainly many things that can be improved upon. I think pharmaceutical prices is one of them. That's where a lot of the healthcare cost growth is happening right now, and there's little ability to negotiate and control pharmaceutical pricing. I think there is room for innovation at the state level, but I think we need to be careful around making sure we provide quality coverage to a large number of people as a requirement, and then let's find more innovative ways to do it, more cost-effective ways to do it, which I think we can, and a lot of that innovation can happen at the state level.
We hear from Oregonians outside of the metro area who had more limited options. What suggestions do we have for those folks who live in the rest of our state as changes are made, potentially?
You mean they have more limited options around access to healthcare right now? Yeah, absolutely. I think, when we're talking about the Medicaid piece, I think that is a big shortfall right now around Medicaid, that reimbursement rates to providers are too low. Meaning that a lot of providers are not accepting Medicaid members to the extent they need. Now that really varies based on what specialty, whether it's dentistry versus physical health versus addictions and so on, what the reimbursement rates are. But across the board, we're finding that it's for Medicaid members, it's harder to access quality services, and it gets harder when you get to rural areas with the bigger gaps, and so on. And so I think that is an opportunity to really think about that. How do we really make the Medicaid system work so that providers will want to buy into it. Kit Sauber had previously put forward an idea that we should have equal reimbursement rates for all providers, whether it's a Medicaid system or Medicare or private insurance, that providers should be reimbursed at the same rate, which I think is a really important idea and principle that we could move toward, and I think that would help to reduce a lot of the access issues in rural areas.
I actually think that the Oregon CCO experiment has been a really good test case for improving access in rural areas. Most of the CCOs, there's 16 of them in Oregon, most of them are locally based, community-sponsored organizations. And I've actually seen, I'm somewhat lucky because I work in the Portland market, and so we have plenty of access to all the various physicians and hospital services that we need. But when you go out to Eastern Oregon, they've done some amazing things out there working with the Eastern Oregon CCO in partnership with MODA on expanding access to alternate workforce, in supporting urgent care clinics and walk-in clinics, in converting school-based health centers to do adult health care in the evenings and weekends. So they've been very innovative. And they've done that because they had this OHP population they were required to serve, and they needed to get access. And so the locally based CCOs who work in their communities and partner with their provider networks are able to come up with creative solutions. So I actually think we're in the middle of a pretty interesting test case for how we could expand alternate resources to the rural area.
I'm curious, too, you brought up the vulnerable populations and the issues that they face on a day-to-day basis, and why the idea of change for the Affordable Care Act could be so scary. I know that I'm asking you to kind of read the minds of certain people and look far into the future, but how far into the future, I guess, is my question. If there were changes to the ACA, realistically, how soon do we think they would come? And what can Oregonians do to anticipate that, to do research now? How do you think about that?
Well, immediately after the election, some of our providers were hearing from clients that they needed to be seen right away because they were going to lose their coverage when the president-elect took office. So that was the initial reaction, was very, very frightened. In reality, 2017 has already been put to bed, so there's not much change you can do there. 2018, there could be changes, but as we all know, it's the midterm elections. And I don't think any time in my life have I been so interested in midterm elections than I am this year. But it's gotten everybody's attention, and now we all know that the House is up for re-election in the 2018 midterm elections, and there's a third of the Senate, and there's a lot of governors of states that took the expansion up for re-election. So we actually have a pretty broad coalition, and I think, you know, just given that political dynamic, but on top of that, I can't believe that somebody would go in and intentionally disrupt something so fundamental to people's needs as their healthcare system. And so I think they are going to do the repeal and delay, or whatever they're coining the new methodology. I think one of the best things they could do quickly is rebrand it, because if they could get Obamacare and ACA out of our lexicon, then they could start owning something, and that would be a useful tool. And so I think that would actually be a great idea. Let's just call it something else, and then we can work on what we need to do to change things and fix things.
That's a great idea. I'm curious, Mel, what have you been hearing after the election? What kind of fears have you heard, and what thoughts do you have in terms of ways we can wrap our head around this and rebrand?
Absolutely. I mean, I think, I think there's concerns, and individuals feel like, oh, coverage will stop right away, which I think is not true. I mean, at the least, we'll see a few more years continuing with the system, with the idea around repeal and delay. So I think that's certainly a concern. I think, seniors are worried around what's happening to Medicare down in the future, and will look really different in the near term. I think there's concerns around the piece around pre-existing conditions. I think there's concern around those in the Medicaid expansion group, that they'll be rollback around Medicaid coverage. On the insurance side, I think the insurance plans rely on stability, and we're in a place where there's a lot of statements saying the system will change without a lot of clear idea how it will change. And that in itself does create uncertainty for insurance plans, and it makes them less likely to jump in terms of offering plans on the insurance exchange or others. And so I think just the fact that there's uncertainty is also creates issues.
The other thing that's important to remember is we talk a lot about the ACA repeal because it's gotten a lot of press, but this year the CHIP program is up for reauthorization, and it has been around for 20 years. It has survived many changes in administration, and many political winds have blown through, and it's always been reauthorized, and it's a really critical part of coverage for kids up to 300% of the federal poverty level. So we want to keep our eye on that as well as it makes its way through.
And that was something I wanted to talk about in terms of the fact that I think has been referred to as excess spending. Is this a new threat? I think you mentioned the fact that it's been talked about in the past, but should we be more concerned this year than ever? Or is this pretty typical?
I don't know if we should be more concerned. I have to believe that people aren't going to use kids as pawns in political conversations. I mean, call me naive, but I'm going to have to stick with that position.
Mm-hmm.
I think there's, should we feel more concerned? Yeah, we should feel more concerned. But I do think, I think a lot of the rhetoric around repealing Obamacare and so on, I don't think it won't fully be realized. I think it's pretty unlikely that there'll be a full repeal of Obamacare. Because the biggest reason is it would be incredibly unpopular for a large group of people that had received coverage to have that coverage pulled. So I think we should be worried, but we shouldn't feel like the whole system will fall apart and be repealed. I do think there's a lot of good elements as well. There's a lot of stuff that's not talked about, and one of those areas is a big emphasis on prevention that came out of the Affordable Care Act. I think those pieces are really important and have not gotten the attention that those deserve. And there's many other pieces. It's a very complicated piece of legislation, and so I think we need to be diligent in terms of thinking of all the pieces that are there and protecting those pieces.
And I think that when you and I spoke, that you talked about that being an area too that could be expanded, and also transparency in the program. And I wonder if you want to speak to that a bit.
In terms of prevention, I think prevention is critical in terms of saving healthcare costs, promoting health down the line. It's one area where we can promote better quality and save money at the same time. The Affordable Care Act has approached prevention in a few different ways. One of them is it's tasked a group called the U.S. Preventative Services Task Force to do evidence-based reviews around preventive services. And they've come up with the gold standard around preventative services. And the Affordable Care Act requires Medicaid plans to cover those services, so-called A and B recommendations. These are things like tobacco cessation services. These are things like immunizations, cancer screenings, a whole lot of good stuff that I think is really important. Now, I think Oregon's in a good place. We have, in fact, Oregon is somewhat of a leader in this area around, we have a health evidence-based review commission that looks at a variety of different services and so on. And so I feel like Oregon has some of the leadership and commitment to continue that focus on preventative services, but for some other states it doesn't. I don't see as much of that leadership to make sure those continue. There's another piece as well around the Affordable Care Act, which is the population health pieces. And, my organization, Upstream Public Health, is really dedicated to looking at health from a broad perspective, looking at realizing that housing and food access and all these other pieces are critical places that encourage good health. And I think within the insurance plans, within CCOs and so on, they're I think that midstream piece around preventative services, really looking at services is really critical. But we also have a second piece, which is from a public policy point of view, we need to create the right conditions so that we have a healthy population. The Affordable Care Act created a prevention fund, which includes about $2 billion a year to promote population health preventive services like tobacco prevention programs at the community level, diabetes prevention, food policy, environmental justice pieces, and I think that's a really important and critical piece of the legislation.
So yeah, actually in Oregon, we're going through a pretty exciting phase right now in public health modernization through our county public health system. And so I think we're really it feels like we're in the sweet spot right now in the space of prevention and public health and accountability. So we're probably doubly hopeful that nothing gets disrupted because we've worked hard to get it where we are, and I think we have support to continue that focus. Public health is a huge part of addressing disparities as well in our communities. So there's just a whole lot of benefit that comes out of those programs in the counties.
For those of you listening in OPB, this is City Club of Portland's Friday Forum. I'm Laura Gunderson, editorial pages editor at the Oregonian. I'm here with Janet Meyer, CEO of HealthShare Oregon, and Mel Rader, director of Upstream Public Health. Today, we're discussing potential impacts to Oregon's healthcare transformation as President-elect Trump reveals his plans for changes to the Affordable Care Act. I'm curious, Janet, you spoke of your optimism that the children and CHIP might not be something that politicians play around with, but I've heard some medical providers concerned that legislation focused on addressing opioid abuse could die in the Congress's current lame duck session. What would be the local impact if that did not remain a federal priority?
I think we've already recognized that opioid addiction is a priority in this state. It's a burning platform. And I think the fact that the delivery systems have all come together and the providers have come together to standardize prescription of opioids. We've connected all the emergency rooms electronically, so we know when people are moving from ED to ED to shop for opioids. We have a huge commitment both in the OHP and in the commercial population. The Oregon Health Leadership Council has taken a big stance in opioid reduction, and I know for our CCO, we're expanding the medication-assisted treatment through both CODA and Central City Concern so that we can get more evidence-based treatment for opioid addiction in our community. I don't think there's any stopping. I think that horse is out of the barn for Oregon. I'm not sure about other states that either haven't recognized their opioid crisis yet or they haven't gotten started working on it, but I don't see any changes in Oregon in terms of addressing the opioid situation.
So the funding there is stable.
Yeah, I think that it would be probably one of the few things we would go to the mat over at this point because we pay for it in so many areas. It's not just the cost of the addiction to the human being, it's their family, it's our community, it's the criminal justice system. The number one reason kids go into foster care is because of addiction. And foster care is an extremely traumatic event in a child's life. It is not something you want to encourage. You want to decrease that. So that is the opioid addiction problem is about much more than that person. It's about the whole community. So I don't see how any one of us walks away from that battle.
Mm-hmm.
I don't have too much to add in this area.
Yeah. Well, we've talked a lot about areas where we feel like we have strength in Oregon and how there is strong support and commitment behind these projects. But for people who are listening, people who are out there, whether or not they have concerns about their own health care, their own health insurance, or others, what can the average Oregonian do right now to get their voice heard, to help support this, to help keep in place those programs that we're hearing about that are so essential?
I think the most important thing is that we show that we have a commitment to expanded coverage, even in the face of budget cutbacks. I think that will be the primary challenge moving forward. And I would also say, as an individual, I was actually, did not have health insurance for 10 years. I grew up in poverty. I had, came out as a teenager without much money and just didn't have health insurance. And at one point, I did get very sick and was sick for 3 or 4 years, and it was one of those things that was very difficult to diagnose. I couldn't get into didn't have access and so on. And so I know on a personal level, and I think there's so many different stories out there, that lack of coverage has big consequences. It has consequences on the individual. It has consequences on our state budget. And that, at a fundamental level, I think we have a moral imperative to provide health insurance for those who cannot afford it. And I'm not saying this, we do have this, not trying to dismiss the significant budget challenges we're facing, and we might see a double whammy of reduced federal coverage and a big hit in terms of the state budget issues that we need to navigate through. But at the end of the day, I think we need to emphasize that moral imperative to provide coverage to those who cannot afford it.
The other day I was talking with one of the executives up at OHSU, and he said he had moved here from Chicago about 5 years ago, and he said when he lived in Chicago, and he's been in the healthcare system his whole career, he said he'd never met anybody on Medicaid. Didn't know anybody on Medicaid. He said, half of my neighborhood's on Medicaid in Oregon. And I think that's one thing that is different here, is that because of our expansion, we have a lot more people that are on OHP, and they're people that look like you and I. This is not an uncommon thing. For 25% of the population is on Oregon Health Plan. 50% of the babies born in the state of Oregon are born on the Oregon Health Plan. So I think the fact that we have this sense of community, knowing that your neighbors could be affected by this, I think that changes people's feelings about the discussion in Salem about the budget deficit, or even the discussion nationally. It's kind of hard when you're in such a blue state to think about how you could influence the incoming administration. On the other hand, we have a very strong story to tell about public-private partnerships, about bending the cost curve, about being responsible with the funds that we're given and accountable, and then transparency as well. So I think we have a good story to tell out here in Oregon, and I think just if the person out there that's not part of this system just sat down and thought about who do they know that could be affected by a repeal of the Affordable Care Act, I think they would get concerned about it. It's their sister or it's their neighbor, and so I think we have a lot of opportunity to influence in that regard.
Do we get enough national recognition for that? And who should be calling out to say, come look at Oregon, see what we're doing here? And
I think we really do. Andy Slavitt was just here maybe a month ago, and he was just blown away by some of the work that's being done in not just Portland, but out in Hood River and in downstate markets as well. He was really shocked at how much we're doing with the funding that we're getting and how really transformative the CCOs are being. We're bending the cost curve, we're saving money. The patient-centered primary care home model that was launched by the state of Oregon is saving money. So we're checking all the boxes. And I think we're telling our story pretty well. I think Governor Brown has really stepped up and expressed a vision around this and a commitment to maintaining the program. So I think we do get more credit. I know for us, we get called all the time about Oregon is so far ahead of the curve in transforming healthcare, and those of us in Oregon are always sitting here thinking, we've got so much work to do. How can they think that we're far ahead? But we are. We've done a lot of creative things, beginning with Governor Kitzhaber and continuing to today. So,
now would you like to speak to that?
Sure. I mean, I think Oregon really has been innovative for a long time in the healthcare arena. Now, I think, of course, there's a lot more we can do. But when you look at healthcare systems across different states, I think Oregon is ahead of a lot of other states. We are innovative. We do have leadership, and I think that gives me a lot of hope that Oregon will find a way to not just maintain our current accomplishments, but to expand it and continue to innovate and improve. Oregon has its own innovative health transformation legislation that created the coordinated care organizations and has been a leader in many ways. I think the focus on metrics, which is really coming up with leading key areas to make progress on and creating incentives related to that, has been effective in a number of different ways. I think in terms of where do we go from here, what can we do better? I think we will need to find a way to control pharmaceutical costs. I don't have the exact numbers, but I think the cost of Medicaid has really become almost flat. But the pharmaceutical piece is increasing at more than 10%. I think I heard a figure of 13%. Individual drugs are seeing enormous potential costs, and the state has little ability to control those costs. So that, I think, is a big red flag of something we need to do something about, but Oregon has limited ability in terms of controlling that cost piece. Other areas that I think are important, I think we can do more around transparency. I think we can do more around community engagement. I think we can do more around creating population-level approaches through county health departments and through partnerships between multiple different agencies. I think there's certainly, we can point to a lot of areas we can make progress as well.
Let's now go to the audience for some questions. If you have written a question on an index card, hold it high for the staff to collect. I'll read at least one index card question. We also invite City Club members to ask their questions at the microphone. Asking questions at the Friday Forum microphone is a benefit of City Club membership, and membership is open to everyone. Please identify yourself as a City Club member and ask one question in 30 seconds or less. And we have somebody up there ready to go.
Hi, Becca Taplin, City Club member. So given that mental health care access has been an essential component of the Affordable Care Act, I was wondering if you could speak to anything in particular that you think might happen if the Affordable Care Act is repealed or significantly altered. And then also, hopefully on a more optimistic note, what we can do in Oregon to ensure that people still have access to quality mental health care on an equal level with medical and physical health care.
So the Mental Health Parity Act is separate from the Affordable Care Act. Even if they did manage to repeal the Affordable Care Act in its entirety, it would impact those people who got health insurance through the Affordable Care Act, but it wouldn't impact the existing benefit structure. So they would have to overturn the Mental Health Parity Act. Having said that, the mental health system has been underfunded for years, decades, and it's a very different system of care than hospitals and traditional physician offices, and they do need more investment. And anytime funds get tight, which could happen, that means we have less to invest in some of the more transformative opportunities, like improving the state of the mental health system of care. So I think there are risks, but in terms of mental health parity, Affordable Care Act wouldn't touch that. We'd still have to give parity in benefits. Did that answer your question? Okay.
City Club member Ken Franson, and I have a question about pre-existing illness coverage in the absence of the ACA. Without ACA, does Oregon law provide any protection for people who are currently insured, have pre-existing conditions, and would want to continue that insurance?
I actually don't know the answer to that. So,
Well, so the Affordable Care Act pre-existing clause states that you can't be excluded from getting insurance because of a pre-existing condition. If you're already insured and you have a pre-existing condition, that's up between you and your insurance company if they exclude that coverage from you or not. And I don't believe there is a state law that would cover that if you're privately insured. If you're publicly insured, it's different, but.
So I'm going to read one card I've got here. Do you support the governor's recommended budget, specifically premium tax, real hospital tax with significant cuts to CCO rates and/or taxes? What are specific alternatives you do support? There's not any.
So the deficit in the Oregon Health Authority budget is substantial this year. You know, we always could point to PERS, and you know, yeah, we're bad, but PERS is worse. Well, this round we're actually driving a bigger deficit than PERS, so it's a tough conversation we're having right now. There was no way we could dig out of this hole without doing a mixture of revenue enhancement and expenditure reductions. And I think the governor struck a balance. This is a recommended budget. It'll go to the legislature, and we'll work with the CCOs and the delivery system and the hospital association to balance out how we're going to work our way through this without reducing coverage and without reducing benefits. And I think we can get there. I think it's going to take a little horse trading, but that's expected.
I like to be optimistic, and think we can be successful in creating a grand bargain. We're coming out of a proposal for a significant corporate tax that was voted down strongly. But I also think now we're going back to the place where I think nobody wants to, cut coverage. Nobody wants to reduce school days by like 14 or something is what they're suggesting would have to happen to get to the cost savings in terms of the budget deficit. I don't think anybody wants to go down that route right now, and I'm hoping we'll find a way to say, okay, we aren't doing that proposal. Let's find some ways to raise revenue and provide critical education and healthcare services and so on. And so that's really what I'm hoping will happen. If that doesn't happen, then there's no good way to balance the budget other than cutting back education and health services.
Let's go to the microphone.
Kurt Wavering, member. When the Affordable Care Act was passed, there was a Democratic majority. Not a single Republican voted for it. Now we have a Republican majority. If the new president decides he wants to get rid of the Affordable Care Act, do you think that there are enough moderate Republicans that might not follow him and come up with legislation that preserves the better part of the Affordable Care Act?
I think politically it'd be really difficult to kick 21 million people off of health insurance. So they are going to come up with a replacement plan. What that looks like is yet to be explained to any of us. But I think there are reasonable Republicans, just like there's reasonable Democrats, that can sit down and come up with something that gets people the best that we can, given the situation, and protects those lives from becoming uninsured. We also have, some big lobby efforts. Pharma has done very well under the Affordable Care Act. Having fewer uninsured patients is good for the hospital systems. So there's I think there's a broader coalition than many of us recognize that would want to maintain the level of insured coverage for our nation.
really agree with Janet's assessment. And when you look at the individual votes, I mean, we're looking at a Senate with 52 members, 52 Republicans. We already kind of heard from Susan Collins that she's really not in favor of repealing the Affordable Care Act. I think there's other somewhat moderate Republicans. John McCain has said a few things, and there's no love lost between John McCain and Donald Trump. And so I think getting a majority in the Senate is actually would be a pretty significant uphill battle in terms of a significant repeal.
Hi, Walter Robson, a second City Club member. Over the past few years, there have been advancements for the LGBTQ community when it comes to healthcare. And a lot of those were under executive order when it comes to the transgender community. Where do you see the ACA and some of those executive orders when it comes to healthcare with the transgender community? And what hope do you have for them in the future under a Donald Trump presidency when it comes to insurance?
I'm not as familiar with some of the broader policy conversations around the LGBTQI community, but in Oregon, transgender healthcare benefits are part of the prioritized list, and so that was not a federal choice. That was a choice that the state made to cover the medical costs for transgendered OHP enrollees. So I can't see how they could. They've authorized the use of the prioritized list, and we've put it above the line on the prioritized list, so it's there. But Mel may be able to talk more about some policy issues.
Yeah, I mean, Trump has a lot of ability to, repeal executive orders in a way that is much easier than the legislative approach. And so there's, unfortunately, I think there's a good chance there will be rollbacks in terms of that, in that area and others. I do think, at the state level, I think we'll, given that it's already above the line in the prioritized list and other areas, I don't see that necessarily affecting the way Oregon provides care, but it will certainly affect it in other states, I imagine.
Carl Vander Zenden, City Club member. It's impressive to hear all the good work we've been doing in Oregon, and I'm wondering, given the instability of federal policy and the possible repeal of parts of ACA, if it wouldn't be possible for the state of Oregon to create a state-run insurance program modeled after Medicare that any citizen of the state could join.
Go for it, Mel.
I think that makes so much sense. I think that was under discussion in terms of the waiver from Oregon that Oregon is asking from the Obama administration to have a waiver for the next 5 years. I think because of the election, I think the decision has been made to strip back that piece and others in the waiver proposal to really just continue what we have now rather than moving forward with additional innovations like that. But it'll increase the likelihood we'll get a waiver from this administration, which would last 5 years and protect a lot of the progress Oregon has made. I think going down the road, you look at how the majority of the industrialized countries provide health care, and it is in much more broader and more innovative, having a public plan that anybody can pay into, or providing a single-payer healthcare system, or so on. And we know there are dramatic savings in cost savings in terms of moving down that approach. I think the biggest weakness around the American healthcare system is it's just divided up into all these different pieces, into the employer-based system, the Medicaid system, the Medicare system, the insurance exchange, private plans, all of this, and that creates a lot more bureaucratic costs. It makes a lot more requirement for regulation. It makes, there's a whole lot of disadvantages to that. And I'm not saying just because we have a public option that suddenly we'll have a fantastic quality system. I think there's a lot more that needs to go into designing a system that is affordable and works for everybody, but there's also a significant amount of advantages.
Mary Nolan, member of the City Club. I'd like to get back to balancing the state's budget, and particularly within the OHA. I'm executive director of Planned Parenthood Advocates, and we put our good name and efforts and personnel behind supporting Measure 97, which would have affected us and our members. I personally walked for Measure 66 and 67, which took a chunk out of my family budget. And I'd like to ask each of you what your organizations will personally bring to the table as your contribution to balancing the OHA budget.
Well, the governor has proposed a Medicaid premium tax, or a premium tax, and that would affect health share. So we would be paying a tax. The governor has proposed a rate freeze, so we would have our rates locked in from now until December of 2018. So there would be no rate increase for us. Trying to think of what else was in there. Oh, a reduction in the amount that we could spend on administrative costs. So squeezing that down. So in terms of health share and all the other CCOs, we have quite a bit on the table to help close the budget gap. I think we have a lot more to offer in that we have the ability to save costs in the long run, so we have to balance out the need to keep investing in the transformation in the short run so that we can get the long run savings. But I think for this budget cycle, we have to do a bit of both. So.
I'm sorry, does that mean you are endorsing the governor's budget proposals?
We are supporting the governor's recommendations to maintain coverage, to maintain benefits, and to cover all kids. The how we get through it is what's going to be unfolding in the next, few months. So we'll be at the table along with the delivery systems, along with all the other insurance companies. It's incumbent upon us to meet the goal of coverage and benefits while filling this budget hole.
I'm representing a fairly small nonprofit. And we do have a, significant advocacy agenda around the legislature and the budget process. We supported Measure 97. I think it's sad that Oregon has the lowest corporate tax rate in the country. And even in a fairly good economic time, we're looking at a huge budget deficit and potential cutbacks that we can't really afford. I hope we can find a way to have a more stable tax base moving forward. And I think as part of that, I think we do need to have big businesses pay their fair share, and we can find a way to make that happen. In terms of the governor's budget, I think it's, there's some pieces I support, other pieces I don't. Definitely support the expansion for healthcare for all kids. I think, there's other pieces I don't support. I think it'll be, one piece that I think is really important is continuing progress around public health modernization to really invest in our county health infrastructure, because that's going to be really critical for both saving money down the road, as well as having an infrastructure to respond to anything, any big changes that happen at the federal and state level. If we do see cutbacks in coverage and people are trying to find free services when they don't have coverage, they'll go to the county health departments to get those services. And so I think it's really essential that we strengthen that system and strengthen the role of local government in terms of responding to some of the challenges ahead.
We are out of broadcast time for today. We obviously could talk about this topic all day long. If this program has inspired you to join City Club, you can do so at the registration table as you leave the room. I'm Courtney, president of City Club. Special thanks to Daniel Kapua and Sam Metz of the Friday Forum Committee for producing today's program. Please join me in thanking our guests, and we're adjourned.